Shawn and I have had the pleasure of visiting Greg in his beautiful clinic. And one of the things that I think sets him apart is how you approach medicine with your patients. And I would like you to share, like, what's your thought process and how that all works for you? Like, how does this come together? Because you're unique.
I might be a unicorn, maybe. I don't know. But so I really think that medicine, Janet, is best practiced in relationship. And I think that that is one of the really big things that's missing in medicine today. And especially if you're working within a system, we know that you have to see patients every 10 minutes and you have a number of quotas that you need to meet. And if you don't, then you get called in by mid-level management and that is discussed about why you aren't producing.
Right.
And so we don't do that at Compassion. How do you develop relationship in the context of a medical clinic? Well, here's my thought process. My responsibility is to come in and to sit down and actually sit down and look the patient in the eye and to carry on a conversation. And if I ask good questions and the patient gives me honest answers, then we're going to be a really, really, really good team. And that's really, I think, unique to us, is because I have a nurse practitioner by the name of Gavin Baker who does that exact same thing. He really totally gets it as to what medicine looks like. And we do have a why that we might explore a little bit later on. But I tell the patient that. And so we have this conversation and I just tell them, hey, I'm on your team. And it's not that Greg knows everything and you know nothing. It's the exact opposite. We are at a level playing field. And I say, you've lived in your body for 45 years and you know how it feels. You might not be able to put a diagnosis to it, but that's where I can come in and help. And so it's a level playing field. And actually, I tell the patient, you're the one that's really the more important one in the relationship, because it is your health. So when you leave the clinic, it's my hope that you feel like you've been listened to, that I've heard what you've had to say, that I've examined you in the systems that are appropriate for the visit, and then touched mentally and emotionally, and if and where appropriate, spiritually. I never push spiritual things on people, but if that happens to be a part of their life, then that's what we'll do. And then the last thing I'll tell a patient is this: if I'm not the right flavor of ice cream for you, it's okay. Let's just help you find the right flavor.
Right.
And all of a sudden people just go,
This is
and
nice.
we're off and running.
That's really cool.